Hello, we are here just to raise awareness for the 4th of March, which is the Obesity Awareness Day, about obesity. Obesity is a chronic disease, it's not a cosmetic issue anymore. We are trying to blame patients for their lack of willpower for their obesity, but obesity actually is a chronic disease which is causing a lot of troubles in our society. Since the 80s, obesity has been growing all over the world, in the developed countries faster than in the poor countries, but as well in the poor countries nowadays is becoming a problem step by step. You have to have a look to the middle-income countries like India, Mexico or Brazil, and obesity is a huge public health problem. We are coincidental with this 4th of March, of Awareness Day for Obesity. Somabariatrics is accomplishing the 5th year working for Gibraltar population and Costa del Sol. We have operated on hundreds of patients with fantastic results, and we are actually changing their lives, turning their chronic disease into a normal life. They can enjoy their bodies, they can enjoy the meals, and they can re-socialize, marry, have children after our treatments. The good thing of Somabariatrics is that it's the only team all around the Costa del Sol which has all the treatments medically proven useful for obesity available. We have from the diet and lifestyle modifications with our personal trainers and dietitians up to the more complex bariatric surgery, like the redo thing for people who had a failed procedure like gastric bands or sleeves when they are regaining the weight after these previous operations. So our catalog is having all these things which are useful for our bariatric patients. That's the reason the patients can make their choice alongside our counseling to pick up the most beneficial procedure for themselves. Nowadays as well, we are having a lot of interest in the new medications for obesity. These new drugs, GLP-1 agonists, new drugs for obesity, because we have been using them for many years for diabetes, having opened a new door for obesity treatment and allowing patients to have treatment when they are not entitled, or they are not accomplishing the rules or they are not that big to have a bariatric surgery. Amongst the different treatments we have, besides the diet and exercise and behavioral changes, thanks to our psychologist, we have as well these GLP-1 drugs that we are using alone or as a complement for the endoscopic procedures we are doing, mainly gastric balloons. We have the two best gastric balloons in the market, the gastric balloon which is swallowable 1, Ellipse, very famous. You take it like a pill in the clinic, we inflate the balloon and it's lasting for 4 months in your body and it's pushing you to accomplish the diet. Always all the treatments are multidisciplinary treatments, so we need the help of the dietitians, we need the help of the psychologists, and we need the help of the medication and the devices of the surgeries we are using. As a second good balloon, we have the adjustable SPATS balloon, which is an amazing balloon which is reporting the best weight loss numbers all around the world because it's adjustable. We can inflate the balloon in the middle of the treatment. It's lasting in the stomach for 1 year. We need to put it through endoscopy, and in the middle of the year, if the weight loss is not satisfactory as we have expected, we can increase the volume of the balloon and push the patient for another 6 months of treatment. After this, the last step of the treatment for the severe cases when the patients are very big or have been relapsing on the obesity for many years is the bariatric procedures. Sleeve gastrectomy has developed as the most performed procedure all over the world, and it took over the gastric ban many years ago, and is consisting in cutting the stomach and transforming the stomach in a banana-shaped stomach, removing all the back of the stomach, is decreasing the size, increasing the satiety the patient has, and decreasing the appetite because the ghrelin, which is a hormone which is going away with the fundus of the stomach, is disappearing of the body. Alongside the sleeve gastrectomy, we have gastric bypasses. Gastric bypass is an amazing surgery. It's been performed in the world for more than 30 years. It's the best surgery to treat type 2 diabetes alongside obesity, and is the most efficient reported surgery in the bariatric catalog. The amazing thing of gastric bypass is you can have a maintained weight loss in up to 80% of the patients we have operated on, alongside with the resolution of all comorbidities. Satisfaction after gastric bypass is very high. Nowadays we have a new emerging gastric bypass. We call this mini gastric bypass or one anastomosis gastric bypass, and we're using it for the most extreme cases and for the cases when the previous surgery has failed, like a sleeve has failed for the patient. We can transform this sleeve into a mini gastric bypass, which is causing an amazing weight loss in these failed cases. Thank you very much for your time. I hope you can find this information useful. We are celebrating this with a lot of happy patients we have around, and some of the prospective who are interested in this kind of treatments. There is no reason to suffer anymore. It's time to change your life. Thank you.